Hello, everyone. This is Dr. Shruti Sridhar from the Purple Coat Clinic. And in this video, I'm going to be talking about PCOS. Now, PCOS has become a very, very common term. I think sadly, because it is so commonly found in all the populations. 1 in 3 women seem to suffer from this particular syndrome. Now, what is PCOS? It's an acronym for polycystic ovarian syndrome. It is much more than just an ovarian problem, and it is much more than just a reproductive issue. So in order to understand and in order to reverse PCOS, it is very important to know what it is and to understand the basics. So in this video, I will share a small presentation and I will take you through the basics of PCOS. It is extremely easy to understand, and I have tried to use as little medical terms as possible so that everybody can get the idea and they can start implementing the changes in their life, right? So I'm going to quickly share my screen. Great. So I'm sure everybody can see this. I am an integrative medicine doctor. So I use an integration of modern medicine as well as alternative medicine. And under alternative medicine, I use a wide array of tools that I have with me. So there is homeopathy, herbal medicine, medical cannabis, acupressure, diet, lifestyle changes, and a lot of other things. So I'm going to be explaining how PCOS can be reversed using an integrated approach and how you can start by yourself implementing these small changes in your daily routine, right? Now, as I already said in the video, PCOS is not just related to your ovaries and your reproductive organs, but it is a multi-systemic hormonal imbalance. Now, for those of you who don't know, hormones are chemical messengers in our body. They are released from one part of the body, but they affect the function of the entire system or the entire body. For example, you have thyroid that releases the thyroid hormone. You have the insulin that is released by the pancreas. You have the estrogen and the progesterone, which is released by the reproductive organs, the testosterone, which is produced by the testes, and the adrenals. So there are a lot of hormones in our body, not just 1 or 2. And PCOS is actually a result of a multi-systemic, multi-hormonal imbalance. It's not just the estrogen and the progesterone and the testosterone, which are the male and the female hormones, but also the other hormones, which we are going to see shortly, right? And it is not necessary that the ovaries should be affected. Like, even though the name has a polycystic ovarian syndrome, it is not necessary to have cysts in the ovary to actually have PCOS. Now, PCOS in the olden times was also called as PCOD, polycystic ovarian disease. This was because when this condition was first diagnosed through an ultrasound, they saw a lot of cysts in the ovaries and they called it as polycystic disease. But as science further, research further, everybody understood that it is no longer limited to the ovaries, but still the name kind of stuck. So it's kind of a misnomer, if you ask me, to actually name it as polycystic ovarian syndrome. But as I said, the ovaries may or may not be affected, and we'll soon see what are the different symptoms that can come up. Now, the next logical question is what actually causes PCOS? Now, this is the most simplistic definition that you can get about why PCOS happens. It's very simple. Now, when you have a high sugar level in your body, now by sugar, I don't mean just refined sugar. It can be carbohydrates. It can be any other hormone which causes a higher sugar levels in your body. It can be a lot of other reasons, which we will see. Now, this makes you release the insulin so that the sugar can be utilized. Now, gradually what happens over time, you develop something called as an insulin resistance, which is basically the hormones work in a lock and key mechanism. So the insulin is like a key and the insulin receptor is like a lock, right? And they both, when the key goes into the lock and it opens, the effect happens. But in insulin resistance, there is a key, but the lock kind of changes slightly. So the key no longer functions in the lock. So you have something called as insulin resistance. Now, when that happens, you keep secreting a lot of insulin, but your body stops responding to the insulin that you're secreting. And gradually, this can lead to an increased estrogen levels in your body, increased testosterone levels in your body, decreased progesterone, higher prolactin. So there is a ripple effect that happens because of the insulin resistance that has developed, and that finally leads to PCOS. Now, when you actually go to a gynecologist with a PCOS and who is not aware of this scenario, they might put you on a hormonal supplement that contains estrogen and progesterone. But if you actually see, the hormonal supplement works only at this level, whereas the problem starts with insulin resistance. So we have to correct the insulin resistance to correct the ripple effect of it and to correct the PCOS, right? Now, obviously, the next question is going to be what causes insulin resistance, right? Now, there are a lot of causes, but I have kind of narrowed it down to 4 main causes, which usually happens. There are many more causes. I'm just making this a little simplistic so that it's easy to understand. Now, the first cause is lack of exercise. Now, what I have seen in my practice is that usually the age of onset of PCOS has now reduced, and it is somewhere between 15 to 21, 22 years of age. Now, what distinctly happens at this time, especially in India, is that the children are giving their 10th exams, their 12th exams, their entrance exams, they are in graduate school, etc., etc. So there's a lot of pressure to study. In that process, there is definitely a lack of physical activity. You know, they don't give much importance to movement, cardio, exercise, gymming, etc., etc., and that eventually causes insulin resistance. The second most important cause is stress. Now, stress releases a hormone called as cortisol, which keeps your blood sugar always elevated. You know, cortisol is like an emergency hormone. It's a fight or flight hormone. And you need it in cases of emergencies where you are under stress, like real physical threat. But today we see stress in the form of psychological stress, work stress, study stress, relationship stress, etc., which is not a direct physical threat, but it's still a constant stress on the body, which increases the cortisol levels, which indirectly causes insulin resistance. The third main cause is again a high sugar diet. And by sugar, I don't mean just refined sugar and sweets, but also other forms of sugar. So there is carbohydrates, high carb, like having a lot of grains in your diet, having a lot of refined flour, having a lot of fast food, junk food. There's also having a lot of refined oils. This also causes insulin resistance. So diet plays a huge role in promoting insulin resistance. And the last cause, which I also think is very important, is lack of sleep. So you have kids and adolescents and young adults going through the night, partying, sometimes studying, sometimes playing video games. And this kind of sets off a very damaging diurnal pattern in the body. And we have a circadian rhythm. Our body functions well when the sun is up, and our body needs to wind down when the sun is down. But this rhythm, when it's not respected, it causes a lot of hormonal changes. Similarly, cortisol is released. A lot of other hormones are released, which again promotes insulin resistance. So basically, these are the 4 major things that promote insulin resistance. Other than this, you have chronic inflammation. If somebody is suffering from autoimmune conditions, any sort of allergies, asthma, which keeps the body in the constant state of inflammation, can also cause insulin resistance in the long run, right? So all these things cause insulin resistance, which cause a an imbalance in the estrogen, progesterone, and the testosterone levels, and which finally lead to PCOS. Now, what is the diagnosis of PCOS? Well, if you see the definition, the diagnosis is symptoms plus lab tests plus ultrasound. But what I have seen a lot in my practice is that we get a lot of symptoms, but we sometimes don't get like imbalances in the lab test necessarily, maybe because the reference ranges are very different. And we don't get a lot of findings on the ultrasound as well, because as I said, the ovaries may or may not be involved, the uterus may or may not be involved. So I like to go by the physical signs and symptoms. These are more reliable, and these are also indicative of subtle hormonal changes that are happening in the body. And these signs are often preceding the frank or severe clinical diagnosis. Like if anybody comes to me for treatment for, say, severe PCOS with a lot of cysts in the ovaries, I would actually ask the history, and I would see that over the last maybe 6 or 7 years, they've been suffering from small symptoms like these. And so I like to call them as early signs. So if you catch them early, it might not even proceed to become a full-blown PCOS picture, right? So these are the early signs. The first one is sudden excessive weight gain, which we do see. They've been sitting inside, especially now since the lockdown. I have heard this a lot, that I've gained like 10 kgs over the last 1 year or 15 kgs over the last 1 year. Not surprising, right? So sudden excess weight gain, irregular periods. It can be early, it can be very, very late, you can skip a few cycles, all that is possible. Darker, thicker body hair, not just body, but also especially on the upper lip, on your jaw area, chin. You get thick, coarse hair, which is again an indication of high testosterone levels. Mood swings. This is actually a very early marker. So around puberty, when girls start getting mood swings, when the beginning of the periods, this is also an indication that yes, maybe just keep an eye out for some imbalances if there are, sudden depression, or feeling very anxious, or feeling, wanting thrill-seeking behavior, I call it, where you want certain excitement in life, so you might run away from home, or somebody might take up smoking. So these are all part of the picture that we get. Pain in the breast before periods or even during periods, again an indication of excess estrogen in the body. Acne is an indication of excess testosterone. And a systemic symptom which I come across quite frequently is allergies, rashes, and eczema. Now, these symptoms can be there even 10 to 12 years prior to the PCOS being diagnosed. Like a girl might have allergies and rashes since she was 7 or 8 years, and then when she hits puberty and her period starts, within 6 months, she's diagnosed with PCOS. So these are like very, very early indicators that something is really happening that needs to be looked at. Now, these are the early signs, which I call them. And if you have any of these signs, then I think it should raise a red flag that maybe something ought to be checked out. So once you've understood the signs, you've understood why you get PCOS. So now let's talk about how can you fix it? How can you reverse it? Can it be reversed? Well, the short answer is yes, it can definitely be reversed and maintained, provided a few things are done. And we are going to see what are those few things, right? And the first and a major thing that I love to talk about is lifestyle, because whether it be PCOS, diabetes, hypertension, anxiety, all these things are a result of our lifestyle today, which, let's be honest, is not the ideal lifestyle, right? So we have to look at what we can do differently. That is the first thing. Now, in lifestyle, the first thing that you see on your screen is the sun. And yes, we are lacking a lot of sun exposure in our lives. So vitamin D supplementation or regular sun exposure is something you have to consciously be doing, because it it is not just good for PCOS, but also a lot of other things, like improving your immune system, reducing infections, helping in weight loss, managing your metabolism, your energy levels, your calcium metabolism, all of this, you need the sun. So get enough sunlight. Physical exercise, movement, yoga, aerobics, cardio, anything that you do, at least be like have a moderately active lifestyle. That is what I would say. And if your job is sedentary, then try to incorporate at least 5 to 6 hours per week of exercise, and which should be a mix of cardio, yoga, as well as weights, because it does help. Weightlifting also helps improve insulin sensitivity and thereby reducing your PCOS. So it has to be a mix of all these things. So be a little mindful of what sort of exercises you do. Do you keep yourself active? I love this photo. It's a photo of me and my daughter walking in nature. We need to connect more with nature, because nature has a way to balance our hormones. We feel less anxious in nature. There was a study where they saw that children with ADHD, or attention deficit hyperactivity disorder, if they are kept in nature for 3 hours a day, their symptoms and their aggression and their attention span drastically improves. So this is not just true for children, but it's also true for adults. So you have to find out pockets in your life and in your routine where you can connect with nature, be with nature, walk in nature, and get that connection back. Sleep. So as I said, sleep is a very, very big contributor to stress in our life. So if you don't sleep well, you are going to get lifestyle diseases related to stress and other things. Here I want to add that it is very important to sleep at the right time. So you can't say I skip the night sleep and I sleep 8 hours in the day. Will that do it? The unfortunate answer is no. You have to sleep in the night, and that is what balances the hormones, right? So if you are, having a night shift job, you are working nights, it's a little difficult. So there are certain things that you could do, which I'm not going to discuss now, but definitely there are certain things you could do to help you improve your insulin sensitivity and your metabolism, even though you're awake in the night, but it has to be consciously done, right? So sleep. And the last thing is that is really important is having a good community. So having a close group of friends, family, or people that you connect to, people that you relate to, and people that you enjoy with. That's very, very important. So just summarizing, good sun exposure, movement, exercise in your daily life, connecting with nature, sleep, and having a community to bond with. These are certain things, if you take into consideration, it can be an answer to reverse not just PCOS, but even other lifestyle related diseases. Now, when we talk about lifestyle, I think nutrition and diet becomes a big part of it. I am not going to go much into details because there is a lot to talk about nutrition. I'm a nutritionist as well, and I feel that nutrition has to be personalized. There is no way that you can have a one answer fits all solution. It's not possible. So it's a little personalized, but still I have tried to generalize some things which definitely help women who are suffering from PCOS. Now, there are some things that I am very strict about, that I asked to avoid. Now, first thing is dairy. So dairy includes milk, yogurt, buttermilk, paneer, cheese, anything that is made from dairy. Dairy fat, which is like butter, ghee, these are fine because they don't have the milk protein. The problem is with the milk protein and the hormones that come with the milk. But the dairy fat is okay. So ghee is all right, butter is all right, but stay away from the other things, which I just mentioned. No processed food. So processed food has a lot of sugar, lot of milk protein, and milk products are definitely there. They are processed, so they really have no nutritive value per se. And it is just a big marketing gimmick that they say, oh, Kellogg's is good, cornflakes is good, this is good, that is good. It's all bullshit, right? None of these manufactured processed foods are good for you. And they have tons of sugar. They are made from refined oils. They have refined carbohydrates, which immediately convert into sugar when you consume them, right? So absolutely no processed food. Antibiotics, basically what they do is they not just kill the bad bacteria, but also the good bacteria. And this affects our body's metabolism and hormonal balance. So unless it is really necessary, like it's a severe infection, you can't avoid taking the antibiotics, do not pop in antibiotics just so, because you have it. Because I know in India, it's available over the counter, and I have seen people taking it very indiscriminately. And it not just leads to antibiotic resistance, but it also spoils your health in turn, right? So try to avoid unnecessary antibiotics. No sugar. I think this has been discussed quite a bit. Alcohol. Alcohol is another thing which affects your carbohydrate metabolism, your fat metabolism, and it also contributes to the sugar levels in your body. And when you drink alcohol, usually there is something that comes with it. So you eat with it, you have sugar syrups with it, you have other things that that are going on with it, and it affects your liver. So when your liver gets affected, it affects the detox pathway for the hormones as well. So your estrogen is detoxed from the liver. But when you drink alcohol, your liver detoxes the alcohol instead of the estrogen. So your estrogen goes up, 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 finally causes estrogen dominance, and you end up getting symptoms of PCOS, right? So alcohol does a lot of damage, especially to women, also to men, I feel, but to women, it does a lot more damage. So try to cut down on it or even give it up altogether if possible. The last thing which I generally tend to avoid is gluten, which is present in wheat and wheat products. So you have wheat, rava, maida, dalia, anything that is made from wheat has gluten in it. And wheat, it's a very big explanation, and I'm sure it's a different video altogether, but the wheat protein, which is gluten, contributes to PCOS very significantly, right? There have been some studies as well that show this. So try to avoid it. So if you're starting with a lifestyle change and diet change to reverse your PCOS, these are the things that you need to avoid. What can you eat? You can eat everything else other than that. So you can have your chicken, mutton, eggs, fish, veggies, all veggies, all fruits, all of it is completely fine and allowed, right? So this is a very broad yes and no's for diet in terms of PCOS. As I said, nutrition is something which is highly personalized. So it's very difficult to, give a universal answer here. But if somebody were to start on their own, this is something that they could start with. So let's come to wrapping up this with how do you manage, or how do I manage when somebody comes to me with PCOS? So how do I manage the symptoms? That is what I will be telling you, and how do I help them reverse their PCOS? So first thing is to correct the modifiable risk factors, which we discussed in the beginning. So stress, sleep, exercise, going out in nature, correcting any loneliness or anything which is there. So these are the things that are modifiable, and that has to be done by you rather than the doctor. So correcting the modifiable risk factors, correcting the insulin resistance. So this can be done through exercise and diet. There are also certain supplements and medicines, allopathy as well as alternative medicines, that help in correcting insulin resistance. So I help them with that. The next, I give them a personalized diet, which is diet in a sense. I coach them as to how they can incorporate these dietary changes into their daily lifestyle, because I believe that any diet should be sustainable. It's not something you do for 2 months and then let it go. It doesn't work like that, because it's a lifestyle disease. So I give them, I sit with them, I work with them and give them a diet plan which can actually help them maintain it throughout their life, right? So diet, exercise. There are a lot of supplements. I had discussed vitamin D in the presentation, but other than that, you have B12, B6, B3, iodine, beta-glucan, primrose oil, inositol. Is a huge list of supplements that can help. So now don't go about and supplementing by yourself, because not all the supplements are necessary. So talk to your healthcare provider. Maybe they can help you as to which supplements might be more helpful for you and which is not very helpful for you, right? Homeopathy works wonderfully, not just in symptomatic relief, but as I said, it also corrects the imbalances. So it corrects insulin resistance, corrects hormonal imbalances. If you have irregular periods, it corrects them. So it is definitely a great adjunct and a tool to have for managing PCOS. Herbs. Now there are a huge, there is a huge list of herbs that are good for PCOS. I have just mentioned a few. You have chasteberry, ashwagandha, ginseng, maca root. There's also cinnamon that helps. I forgot to mention in the list. So cinnamon also helps in managing not just the hormonal imbalance, but also correcting the insulin resistance. So works both ways. Again, you don't need all the herbs, but you can talk to your healthcare provider or an Ayurvedic doctor to help you with which herbs can be best suited for you. And lastly, I'm going to say that avoid hormonal medications or treatment, because as we discussed in the video, the hormonal medications do nothing but try to balance artificially your estrogen and progesterone and testosterone. But that is not the root cause of PCOS. So if you want to correct the root cause and reverse it, you have to look into the deeper aspects and correct these things in order to correct your PCOS. So the hormonal medications might help you for 2-3 months. If it's very severe and you really need something to manage your symptoms, it might help you, but it doesn't help everybody. And in a lot of the cases, it ends up causing more side effects than beneficial effects. So the risk benefit ratio of hormonal medication, especially in PCOS, is not very good. So that is not something that you would you should consider it when you have PCOS, right? So that brings to the end of my presentation. I think I have summarized this in as simplistic terms as possible. So, and I hope you found this video helpful, right? You can leave your comments in the comment section. If there are any topics that you want me to discuss, you can let me know, and I can have videos on those topics as well. All right. Okay. Thank you. Bye-bye.